Today's guest is the kind of person who redefines what it means to live boldly. Missy Nagin was diagnosed with Variegate Porphyria after years of unexplained pain, skin reactions, and countless misdiagnoses. Her first major attack actually came while working as a bone marrow transplant nurse, despite already having a diagnosis and guidelines from the Porphyria Foundation. Her condition still went untreated for days. But Missy didn't let that stop her. In fact, she did the absolute opposite. She moved across the country to Seattle, close to Porphyria specialists who understood her condition and began living life on her terms. That included taking up a surprising passion, flying trapeze. Yes, you heard that right. Missy performs and teaches at circus art schools when she's not advocating for her own health or traveling the world. She summited Mount Kilimanjaro, cared for patients in Cambodia, and just returned from India, all while managing her porphyria with a treatment plan that includes both Givlaari and Panhematin. She's learned to recognize her symptoms, advocate fiercely in the ER, and chase every adventure with sunscreen, protective clothing, and unstoppable determination. Today, she's here to share her story of grit, joy, and proving that even with a rare disease, absolutely nothing is off limits. Missy, welcome to the Rarely Discussed podcast.
Thank you. I'm excited to be here and share my story.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts, Andrew McManaman
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare. I'm excited to have you because, in that introduction alone, there's a million billion things to unpack. So, as I typically do, just to get some more insight from people about their stories, to rewind a little bit and kind of go back to when things started. So, what did that look like for you?
So I grew up in New Jersey and never really had any issues. And then I went to college, and I went to college in Tucson, Arizona. And I think it was the combination of I started to drink because I was in college, and that's something
Fair.
I think people start to do when they move away from home. I was also in the sunlight of the desert living in Arizona. And I also started to take birth control. So it was the combination of those three things where I started just sort of having all these just very benign, weird symptoms that no one could ever pinpoint. They're like, oh, you have a headache, take some Tylenol. Oh, you have some blisters on your skin, be more careful with your hands. Oh, your stomach hurts, maybe you drank too much. There was never an answer and or a correlation of any of the symptoms. And it sort of went on like that for a really, really long time. And of course, I would drink and I was either very drunk very quickly, and B, never loved, I knew what a hangover was, and I was this doesn't feel like your typical hangover. It feels like there's something wrong, but you're a young college student, so you're sort of well, all right, here we are. This is right. This is it. And the biggest issue, I think, at that point was definitely the skin sensitivity. Just my hands and my face were just constantly covered in blisters, and I was so itchy all the time. But again, sort of benign. Everyone's wear a hat, put some more sunscreen on. No, but I was no, there's definitely this is weird. So I started seeing just a slew of different doctors, and nobody really had a clue or thought anything of it. I did get accepted to nursing school at the University of Arizona, and it was during, I think, like a visit home. My parents were still on the East Coast, that I had seen a couple different hematologists by that point, um, but nobody was able to come up with more than we're not really sure what's going on.
Yeah.
But when I was home on the East Coast, my parents were connected with a dermatologist whose first practice was hematology. And I went to see her, and she was the one who was like, I think you have a porphyria, just like the overall diagnosis. Like, wasn't really sure what type or what to do about it, but like at least knew like the word to say it, and she knew what tests needed to be sent to confirm the diagnosis. So that's sort of where like the diagnosis started. And then once it was confirmed, she set up a meeting with um, Dr. David Bickers and Dr. Maureen Poe, who are big porphyria specialists who happened to be out of Columbia in New York during that time. And I remember before I went in to meet them, Dr. Bickers had given me a call, and he was like, put together a timeline. And I was like, a timeline of what? And he was sort of just like, go as far back as you can remember. Like, how were you feeling? What were you eating? Where were you living? What symptoms were you noticing? Like, just start to piece everything together. And it's probably not going to look like much to you, but it'll give us a timeline of sort of what's been going on. And when I went to see them, um, he like very quickly recognized that it was the combination of living in Arizona, drinking alcohol, and taking birth control that made me start to have these porphyria symptoms. And they actually first diagnosed me with PCT, porphyria cutanea tarda, and then a
Mm-hmm.
couple months later, and after some testing, changed the diagnosis to Variegate Porphyria. And that's sort of where the diagnosis finally came from. And I was finishing up nursing school, still living in Arizona. And I remember sort of like finally getting a diagnosis, which was really great because, you know, you sort of start to feel like a little crazy. You're like, are these symptoms like real, or am I just like making them up, or is this normal? Is this how I'm supposed to feel? Like, you don't really know, and nobody really like understands what you're experiencing. So then you're like, well, am I really experiencing these symptoms, or like am I just making them up? You know, because that's sort of what it feels like as people continue to like push them off as nothing. You're like, well, maybe I am. I don't like, you just don't know.
Right.
So anyway, I finally had a diagnosis, which made me feel like I wasn't going crazy, and like, of course, brought some like validity to everything I had been experiencing for the past, like 5 to 6 years. And then I remember the doctors sort of start to like list off things that like I wouldn't be able to do. And I remember like very vividly, I was like sitting in my apartment, like studying for a nursing exam, and all this was going on. And they're like going through this list of things, and I was like, I'm going to still be able to do everything I want to do, but maybe just like a little differently, or in like some other way, but like right from the diagnosis, like I was never going to let a chronic illness like define how I lived the rest of my life, which felt like really, really important to me when I was first diagnosed, and continues to feel like super important to me in how I live my life.
And with that, I mean, I definitely want to get into the after diagnosis part, but did you know by chance what the difference was in the diagnosis for the PCT for the VP now? Just for people listening that may be contemplating both.
I don't know if I 100% remember, but I think the PCT was like only the skin symptoms, and then when they did further testing, I think it was like what they found in either like the DNA sequencing or something. They basically found more information that was like you have more than just the skin sensitivity of porphyria. You have like the neurologic, expression. I don't know if expression is the right word, but you have the other like component, which is why they decided on the Variegate diagnosis.
Gotcha. Yeah, I know it's pretty much like a hybrid of them,
Right.
unfortunately. But w- jumping back to the diagnosis aspect and just them listing off things that you are no longer capable of or it look different now, it's something that even me with acute intermittent porphyria is something that I juggle too, because a lot of my attacks have come from pushing myself too hard. I was playing college hockey and just overtraining and doing all that, and then it came at me. In your sense, because it's clear that you are athletic and you do a lot of things, where has that line been for you, or have you not found it yet?
I think it's sort of like ever evolving and ever changing. Um, right. I think after my diagnosis, I sort of went on in my life, like, didn't really change. I started covering up in the sun and obviously like stopped taking birth control and stopped drinking, stopped doing all the things that would like trigger the symptoms. And by doing all of
Hmm.
those things initially, it sort of, not that it fixed itself, but I wasn't having any issues. And it wasn't until I was living in St. Louis and I had taken my first job as a nurse, and maybe it was like the stress of a new job, living in a new city, it could be 9,000 different things that actually caused me to have my first flare. And it was sort of from that point forward that like the like realness, I guess, of the disease set in, that like, oh, this is something I need to like figure out how to manage in like my day-to-day life, and like what do I do when I get sick, because that first hospitalization was like a little bit of a disaster. um and I think I'm super fortunate now with where I live and the hematologist that treats me, and she understands me as like a whole person and not just a person with variegate porphyria, and understands if she tells me like you can't do trapeze, you can't travel, you can't be active, you can't, like, I'm going to be like a miserable human. So she's totally
Hmm.
willing to work with me and to like allow me to push the limits, and with the understanding of, well, if you get sick, we'll deal with it and like then have to readdress, what happens after, if that makes sense.
No, I know it definitely does, and that's a conversation that we have so much on the podcast too. Is like you have all these doctors that are like, you have this, you can't do anything in your life. You're going to be sitting there doing absolutely nothing. Don't push yourself. You don't want to trigger yourself, and I think it's created such a mentality that makes everybody scared to do stuff.
Yeah.
And I think it's nice to hear your perspective of that you can still push to a limit. I mean, obviously there's a line, things might look a little bit different now, but it's nice to know that you can push to a certain limit and still be okay. I think that's a good thing to take away from that.
Yeah, and I think so much of it is like your mindset, right? Like for me, like, yeah, there's definitely chronic pain and discomfort and X, Y, and Z, but like to me, that part feels okay as long as I'm still getting to do the things that I love to be doing, surrounded by like the community of people I've created here.
And with that being said too, just with the active lifestyle, and I know we're not nutritionists here, but with you pushing yourself and having this porphyria, what does a diet look like? Is it something that you've perfected? Are you pretty loose with it? What does that look like to you?
Um, Actually, fairly recently, I've paid like a bit more attention to the nutrition aspect. I'm currently um, part of a like flying trapeze mentorship program by a good friend. Her company, it's called Flyer Fitness, but she was a professional flyer, and has now gained like Pilates certifications and different types of certifications. But has basically put together a lot of programs for like aerialists and flying trapeze artists, like very specific to the movement and type of things that we do, which is like a very niche, it's not just like going to a gym and going to a personal trainer. Um,
Right.
anyway, as part of this mentorship, she had a nutritionist come and speak with us and talk a bit about, like your calorie needs, your protein needs, and all these different things. And I never really paid a lot of attention. Like, I just, I'm an active person. I sort of would like eat when I'm hungry type deal.
Mhm.
And after that, I started actually tracking a bit more of my protein intake and realizing like I wasn't eating nearly enough protein. And since that point have now like increased um the protein and have definitely seen like just changes in how I'm able to like push myself and energy and um all of those things that I think come with paying a little bit more attention to what you're eating.
Yeah, and I think without being somebody who's got a PhD in this space, but would you say the protein aspect? I mean, obviously, loosely everybody knows that protein helps repair muscles when you break them down and helps grow, it helps do that. But would you say it helps your porphyria in any sense, or have you noticed a difference in that? Because I know so many people are so low in protein, like you're saying.
Yeah.
And I mean, bodybuilders will say 1 gram per pound, and then people are like, oh, maybe it's half a gram per pound. And then there's people that are 50 grams a day and they weigh 200 pounds. And it's like, you gotta, you gotta really narrow in on that. So how is that for you?
Um, I mean, I think it's hard to say like what directly helps my porphyria versus like what's just sort of like on the periphery. Like I would
Mhm.
say like I do know for certain that like when I feel good and I'm able to like push my body and train or travel or be outdoors or like do the things that just like innately make me happy, I would say like just as a whole I feel better. Whether that's like physical or psychological, like I'm not really sure. Um and of course, right, like I do think there's like a psychological component to having a chronic illness and like dealing with it day in and day out. So I feel like if I can, not, I don't know if it's like tricking my brain, but like, have my brain
Yeah.
believe that like I'm happy and I feel good, like everything just as a whole feels better.
Yeah, I think that there's so much to branch into in terms of mental health, and that's something that I ask a lot of people about because it's such an important thing. Because when you're not doing good up here, everything else falls apart, and it starts there. And a lot of people just don't think about that a lot. And I'm curious, just with your situation, is you talk about distractions and things like that, and I think people think, yeah, you can go on trapeze and distract your brain from the bigger issue, but if it's something you like and you enjoy doing, it's not really a distraction. Like you actually like doing it.
Yeah.
So in your case, how do you deal with the mental health aspect? How do you cope outside of obviously doing all the athletic things that you do?
I mean, I think it's really hard. And I think I have a really, really unique perspective because I also work as a bedside nurse, right? So I see
Mhm.
patients who, I'm not in the same position as them, but like I've been hospitalized for, 10 days to 3 weeks before. So like I understand the like loneliness and just being like stuck in a hospital room. Like I understand that aspect of, healthcare and like mental health. And I think that has allowed me to like, I think just like really do some like deep reflection on myself and like how I choose to take care of myself, I guess, right? Like, so I feel really, really lucky. I live in Seattle, Washington, and I've created this like amazing community of people around me because I think for a long time it felt like you have this disease and like you have to deal with it. Um, that makes you feel like really alone and really scared and really by yourself. And like, no one should ever have to feel that way. Nonetheless, like when being confronted with something that's going to affect your entire life, possibly for the rest of your life. So I think over time, as I also like learn to accept that like I have this disease that I now need to deal with, I've figured out ways to like include these people who are so important to me and like so helpful to me, and like let them sort of understand and see what it is that I'm dealing with, and sort of like how they can help. Because I think, right, people want to help, people want to be around, and but I think when people don't understand like what you're actually going through or what it looks like, it's really difficult to like insert themselves and do something. I don't know if that makes sense.
No, it makes sense, and it's hard because obviously it's a double-edged sword because I think us as patients probably have the impatience to want to just sit there and constantly kind of spew what's going on in your life, and you're just like, why don't you just want to shake that person, say, why can't you just understand what I'm going through?
Right.
And I think, yeah, with people, I think they are very eager to learn and be involved in your situation. But sometimes I almost feel like we are to blame because we're not sharing it and having the patience to really let them in. And I think that's a big thing is we complain about our support systems not supporting us. But I think we have to, we can't expect them to read our minds, you know. We have to voice it, invite them in, and then collaborate, I guess you could say. So in that sense, I mean, with your support system, I know there's probably a lot of people watching or listening that are like, I don't know how to do it, but you kind of moved to a new area and then built a whole circle around you. So how was that process for you to build that from scratch practically?
um yeah, I think it just starts with like one or two people um that you feel like you can trust, or that you feel like can understand to like the best of their ability. um and then I was just sort of able to like slowly grow that system. And I think, things like just talking about the fact that I have porphyria and explaining to people what that looks like, or I like, after the story came out on the Porphyria Foundation, like posting it on social media and just like sharing it with everyone who sees all my stuff. And um yeah, I just think the more you're able to like let people in, the more able, right, they're going to be to understand. Like you were saying, right, people can't read our brains. They don't know what we're thinking or what we're going through. So um the more you're able to articulate what you are actually going through, and um make sort of like an invisible disease a little more visible, um
Hmm.
the more likely someone may be to understand.
And would you say you found any hardship in kind of just putting that out there? Because there's a lot of people that I talk to that are like, I don't want people to think I'm weird because of this weird thing that I have. So how hard was it for you just to publish your story out to social media and be like, hey, this is what I'm dealing with? I mean, how was that feeling for you, and what was the feedback you got when you did?
So I think maybe like if you asked me this question like 7 years ago, the answer would be different than the answer I'm going to give you today. Because I think today, like, I'm really proud of like the person I am and the person I've become. And I feel excited that like I have the opportunity to like share my story and share like my passion for life and like all the crazy stuff I still get to do. And I think it's like pretty badass that like I have this disease that puts me in the hospital, and that like I get stuck doing infusions and X, Y, and Z and have to avoid this and can't do this, but like I can still do everything else, and like I'm totally like exceeding my expectations of what I thought my life would look like. So like I feel really proud about the person I am
Mhm.
and the person I've become. Where I think like 7 years ago or like closer to my diagnosis, like yeah, there was a little bit of like resentment and more like, oh, this totally sucks. Like I'm 23, I'm trying to date and like I can't have a beer with somebody, right? Like that
Yeah.
part feels really weird when you're trying to like maybe be in a relationship or, you know, meet a group of friends. Like what, like, oh, you don't drink? Like, why don't you drink? Oh, you have this like weird chronic illness. Like, you look totally fine. Like, what's wrong with you? So, like, I think all that stigma, and I also think, like, again, like, finding the right community and the right support system has been like so tremendously beneficial in like me being so comfortable with who I am and having porphyria.
It's such a grounded perspective that you have about it, just being like, yeah, bring it on. And I think there's a lot to take away from that because, and I don't know, maybe it's the nursing aspect that helps. I mean, would you say that there was a situation in time or an event where you maybe saw somebody's situation and they were in bed and you just had this realization that wow, I could be dead in right now, or I could, you had the realization that wow, I need to be more grateful because this person has it a lot worse, and it was one of those comparisons maybe where you were like, I need to be a little bit more grateful. Was there something, an event that grounded you that way to have that perspective, do you think?
I don't know if I could like pinpoint an event or something that happened. I think I've like always been a fairly like grounded person who's able to, I think, look at things like very scientifically, I guess would be like, you know, sort of like take the emotion out of it
Hmm.
um and I think that's sort of like how I like was able to, I think, just like take my porphyria diagnosis and continue to move forward. It was sort of like, okay, like this is something I now have. This is something I now have to deal with. Like, how do we move forward? Not like, oh my God, this sucks. Like, my life has to change. I can't do all these things. Like, you know, it was more just like, okay, this is like, this is a point in the line of life or whatever it is. And now we get to move forward from it.
Yeah, and I think there's, I don't know. I feel like sometimes I have this message in my mind that I either tell myself it could be worse or life is way too short. Like, why are you letting it control you in a sense? And I think maybe it took losing some people close to me to realize that wow, life is extremely short. And I mean, we could just sit here and be in bed all day and be like, oh, Porphyria sucks. I hate it. It's ruining my life. But although there's a lot of people that go through a lot of hardship with porphyria, there's also that mentality aspect that we talked about where people just need to make do with what they have. And like you were saying, building support group, building community. And I think, yeah, I mean, I'm probably not going to do trapeze, but I mean, maybe I do a book club with somebody. Like it's all just based on what you're able to do and you're comfortable with. And I think for the people that maybe aren't as mobile, doing a book club. I mean, the American Porphyria Foundation has one, and just maybe jumping on a Zoom call to talk about common interests, I think is important. So yeah, nailing home the support system and just creating that grounded perspective that you have is awesome. But I wanted to also kind of transition into just the aspect of your treatment because I know I talked about you getting Panhematin and Givlaari. I just want to know how that experience was, just or how it's been for you.
Yeah, I think um if yeah, it's like a loaded question because there's so much around it.
Yeah, it's very loaded.
Like I think
Very.
we learned very quickly that my porphyria is panhematin responsive and that like the panhematin works really well for me and it works really quickly. The problem initially was um even when I first moved to Seattle, and I was working with a different hematologist who has since retired. Um, he was very much, well, your urine PBG needs to be elevated before we can give you the hematin. So he was very much looking for a number to treat and sort of not listening to like the symptoms I was experiencing, where at that point my attacks were pretty well defined by like the neurological symptoms that I was having. I would my vision starts to get blurry to the point of sometimes I would lose my vision. Um, and frequently the hospital would like mess up running the urine PBG, or it wouldn't come back for 2 or 3 days or whatever, or the PBG would come back normal, but I was still having these symptoms. And at that point, I had a diagnosis of Variegate Porphyria, and we knew that I was panhematin responsive, but they still weren't treating with it because the number wasn't showing it, or they were waiting for a number to come back. And that felt like super frustrating because at that point I was in the hospital getting worse. Like the symptoms were all progressing, and you feel like no one's listening to you, and you're telling them like, I have this, like this is what's happening, I know what's gonna fix it, and everyone's like, no, it's this, no, it's this, and you're like how many times can you ask for something and then just be like, well, you're also at that point like exhausted, in a lot of pain, super uncomfortable, like I get really nauseous. There's 20 other things like compounding to the fact that you're also not being treated properly. So this sort of went on for a little bit, and then we started doing like prophylactic hematin infusions, which were definitely helpful. I was starting to get flares like right around my menstrual cycle, which I think is fairly common in women. And some months we would get it right, and some months we would like miss it by 2 or 3 days, and then I would end up in the hospital. But at least at that point, they would just give me the hematin because they knew, like I'd sort of like proven myself like worthy of getting hematin by how many other months of flares that went untreated. So that went on for a little bit, and it would work. I don't know, like 50 to 60% of the time, where we'd get it right and they didn't have to be in the hospital. And then the hematologist I was seeing retired, and I now work with a hematologist. Her name is Siobhan Keel, who's like fairly active in the porphyria world. And I would say she was more interested in like listening to me and was okay with not treating a number, but just treating my symptoms, knowing that if I started to have the neurologic symptoms of vision loss or like the severe nausea and pain, that the panhematin, like that's the start of a flare, and the panhematin would treat it. This was also like, I think, right around the time that the Givlaari became FDA approved. So I remember I got my first dose of Givlaari in October of, I don't remember what year, but I think it was 4 or 5 years ago. And it definitely worked well. Like I wasn't getting the prophylactic panhematin at that point. It was just the Givlaari. But I started having really, really severe nausea with the Givlaari, and they were dosing it every month. And I had like a bit of like unintentional weight loss and really severe nausea that I was like being hospitalized for, where the symptoms of it just like weren't great, and nobody really knew what to do with the symptoms, of course, because the drug was new. So everyone's like, well, do you know what to do with this? Like just sort of asking around in the community, and nobody had like great answers. So I think the first thing they ended up doing was like cutting the dose in half and still dosing it monthly, and seeing if the symptoms improved. which I think they did a little bit, but there was still like a decent amount of nausea. And then we started spacing the dosing out with like the idea of like, how many weeks can we get from one dose of glyvosarin before you would have a flare at this lower dose, and keeping the nausea controlled. So it was definitely
Mhm.
like a bit like a science experiment. We didn't
Yeah.
really, nobody really felt 100% confident in what they were doing. Um, but like, I think I was okay with it because, what was sort of like the other option, because we knew it was working. Like, I wasn't having porphyria flares. I was just dealing with like the symptoms of a new drug. Um, so we got it to a point where I think I was getting it maybe every 9 weeks at this lower dose, and it was controlling my porphyria. And that went on for like a little bit of time, and it felt really great because I was not having flares and nausea was fine. And then I started to have what they were calling like breakthrough flares, like in between the 9 weeks of getting the glyvosarin, where I was having to be admitted to the hospital for 3 or 4 days of Panhematin. So then, of course, we like went back to the drawing board and was like, okay, 9 weeks is maybe like too far. Like, let's try 8 weeks and see if that works. So I think, and sort of now where we've landed after like this like ebb and flow of like what works, what doesn't work, um,
Mhm.
is actually we're doing Panhematin and the glyvosarin every 8 weeks. So we're doing prophylactic Panhematin and the glyvosarin every 8 weeks. And that just started in May. So we don't really have like much to go on yet.
Mhm.
But for the time, it seems to be working. And that I feel like is typically what has happened is like we change the plan, the new thing works for 6, 9 months, a year, whatever. And then something happens. And then I feel super lucky and fortunate that Dr. Keel is like always willing to sort of be like, okay, that didn't work. Like, what do you think we should try next? Or like, this is what I think we should try next. Like, how do you feel about that? And she also knows if she is like, well, you can't travel because of X, Y, and Z, like, I'm going to be a
Mhm.
miserable person. So she's always willing to work like in the confines of like, I know you like to leave the country for 2 to 3 weeks at a time. Like, maybe we give you a treatment right before you leave, and like the day you come home, you're scheduled for treatment so you can get that like extended period of time where we know you'll be safe type thing.
Mhm. Yeah, it's interesting because I mean I've talked about this in some other episodes too, but a lot of people who are newer to the community to porphyria have just kind of heard of this special drug that cures porphyria, and it's Givlaari, and nobody realizes that it's taken in collaboration with Panhematin because they both kind of have their strengths and weaknesses, and people just kind of need them together. So have you noticed just taking those together any downsides, any other side effects from taking those both?
Not from the Panhematin. I think, like I said, like I handle really well, and I really don't have any, I would say, like major side effects from them. I think sometimes I get a headache if it's infused too quickly, but like that's like, I feel like nothing. Like I just ask them to run it slower and it's totally fine. Um,
Hmm.
I feel like the one I struggle with more is the glyvosarin, just with like the side effects of the nausea. Um, but as we're like, again, like constantly playing with the dose and the timing of it, um, it like seems to be okay. And with that, like before I get the glyvosarin, we're now they do like a whole slew of anti-nausea medications, and they give me hydration before and they give me hydration the next day, and like we're sort of doing everything in our power to prevent all the bad stuff, knowing that the drug works really well.
Hmm. Gotcha. Okay. And something else I wanted to ask too, because obviously you're a traveler, you're a world traveler. With there's a lot of people out there that like traveling, like to do all these different activities, and with that in mind, is there any precautions or things that you put in place to make sure that your traveling goes okay? Because I mean, for me, I'm always terrified to travel and go on long flights, and I went to Spain and I just like completely, I mean, my whole face was just like bloodshot and it just was a mess flying. So how's that for you?
Um, so I think I do a couple things. I always travel with really, really good, and like I pay a bit extra for really good medical travel insurance. Um, Knowing that there's like always the possibility that like something's going to go wrong, and I don't want to really have to deal with being treated with wherever I am. Like I want to know that I'm going to get on a plane and come back to Seattle where they know how to treat me. Um, so I always travel with really good medical, like basically like medical evacuation insurance. Um, and I think while I'm abroad, like, the things you do in your day to day life with porphyria, like making sure I'm eating enough, making sure I'm wearing sunscreen, or, making sure I'm still getting enough sleep, even though I'm traveling. And um, yeah, just all the things you would be doing while you're home, but like maybe more to an extreme, and maybe paying like a little bit closer attention, knowing that you're so far away from what like your normal is and like where you would go if you needed help.
Gotcha. And I wanted to ask too about Kilimanjaro because we've had a guest on too that did Mount Everest, and that's when the attack kind of sprung on. So how was Kilimanjaro for you?
I always say Kilimanjaro was like the hardest thing I've ever done in my life. Um, yeah, it was really really hard, and it was really hard to breathe, and it like hurt to breathe. And I'm sure I had like some minor like pulmonary edema where like it was like wet and junky, and like you sort of had to sleep sitting up. Um, but I think for me, it was probably the first thing I did with my porphyria diagnosis to like almost prove to myself that like I could still do anything that like I set my mind to. Um,
Yeah.
and I feel like that trip as a whole was like a pretty defining moment in terms of like my like world travel and like wanting to see the world. Um,
Hmm.
that was um, yeah, the first like big international trip that I took with a really really good friend. Um, and it was just like very eye opening as a whole. And then to get to do something like climb Kilimanjaro was just like really special, and sort of like solidified that like, yep, I want to like do all these things. I want to see everything, and like nothing's really gonna stop me.
I mean, that's one way to do it. And I think unfortunately there's an aspect of our life when it comes to, I mean, not just porphyria, but a lot of rare disease where you kind of have to test the line. It's a little bit of trial and error with yourself, unfortunately, where it's like, when do I crack? Do I just keep pushing until I do? And I mean, I've done that too. I mean, early on, it was, can I get away with one drink? Could I do two? And just kind of, it was one of those things where you just almost had to test. So, I mean, in that sense, I know we talked about you and your active lifestyle and kind of making that line and doing that, but um, I think Kilimanjaro kind of really tests that envelope a little bit, a lot of bit. So I wanted to circle back to the nursing aspect some more and just how that has helped you with your advocacy for porphyria.
Um, I think it does like a couple things, right? Like I feel very I feel very comfortable like in a hospital, and I understand how hospitals work, which I think becomes like a huge benefit as a patient.
Hmm.
Um, it's also like maybe a little bit of like a catch 22, where I'm actually treated at the hospital I work at. So people know who I am because I've been a nurse there for almost 15 years. And I've obviously been being treated there for that same amount of time. So I think just by understanding like the intricacies of a hospital, but I also think like with that being said, there have been still so many times where like I'm in the emergency room or I'm admitted and I'm telling people like I'm in pain or like I'm uncomfortable, I'm nauseous, and like you can tell it's just sort of getting like pushed off to the sideline, sort of where, they like look at you and they're like, well, you look fine. And I'm like, it,
Right.
yeah, I look fine because this is something I deal with daily. And like I've come up with ways, right? Like my pain looks different than your pain. And it's like one of the first things they teach you in nursing school is like pain is subjective. Like whatever the patient tells you about their pain is what they're experiencing, and that's what you have to believe. So of course it still feels like beyond frustrating, especially because I have like a very detailed care plan that's in my chart that is literally like step by step what's supposed to happen like when I come in and I'm having a porphyria flare. And like sometimes it gets followed perfectly and it's great.
Mm-hmm.
And other times it's me being like, can you read? Like it's literally all written there, and then,
Mm-hmm.
and that's obviously when it feels like really hard and really frustrating, and like really demoralizing as a person. And especially when they know that like you're a nurse and work in healthcare, like why are you treating me this way? I don't deserve to be treated this way. Like I'm not here because I'm drug seeking or like want to be here. Like I'm here because there's a problem and I need your help. But like if I could do this by myself at home, like believe me, this is the last place I want to be.
Right.
So that's where it becomes like really, really difficult. And I think again, going back to having a community and having people who will advocate for you when like I'm unable to advocate for myself is like so 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 important, um in having like a chronic disease where sometimes things are so bad that like you can't articulate your needs, or you're struggling to the point that you need somebody else to be like, this is what she needs right now.
Mm-hmm. And I guess for the people listening and watching, because I know there's a lot of them, and I definitely was included in that bunch. But there's a lot of people that just think hospital. They're like, I hate hospitals. It's the worst place to be. I'd never want to go there. What what advice would you have for those people? Just as obviously a nurse who has porphyria, just how to kind of go about hospitals and just to have a better perspective about it. I mean, obviously we have to push so hard to advocate, so in our mind we kind of hate people a little bit,
Mhm.
but or a lot of bit, but in those situations where, I mean, obviously at the end of the day people are there to help. I mean, nobody really wants to, because I mean, you're not a billionaire as a nurse. I mean, not everybody's going in for money. They want to help people. So how do you talk to people, or how would you talk to somebody with advice in that situation?
um I think what has been like most beneficial for me as somebody who as a patient also hates hospitals, and would come up with 9,000 other places I'd rather be,
Right.
um, is to work with whoever your like porphyria doctor or porphyria expert is, and coming up with that like super detailed step by step care plan that like automatically triggers when somebody clicks into your chart. Um, just because even if the person opening your chart is like, I don't need this, I don't need to look at it, it's like much
Mhm.
easier for you as a patient to be like, there's a care plan, you need to look at it. And if you say that to enough people, like someone eventually is going to look at it and follow it. Like maybe it's not the first, second, or even 10th person you encounter. But that is so much easier than showing up to the hospital, like in a lot of pain, like for me, not being able to see, feeling really nauseous, and being like, I have variegate porphyria. You probably have no clue what that is. I have a port. Like, you need to give me D10. I see a hematologist at X, Y, and Z. Like, I need doses of panhematin. Like, there's like just so much information and so much stuff that has to go, that goes into it. Where if it like can already be written out, and in that same care plan or alert that fires, like the numbers of people that need to be called. So like for me, it's like consult the chronic pain service, consult hematology, give a dose of panhematin at, you know, this dosing based on her weight, like right away. So there's like no questions that need to be answered. Another thing recently that I've found that's like been super helpful is, so I get my porphyria treated at like a cancer center that obviously isn't open 24 hours a day. But if I start to feel like I'm having a flare and they are open, to actually go see them first, and they can start the whole treatment protocol. And of course, they're not going to have the 20,000 questions that a poor resident in the emergency room who has never heard of porphyria is going to have. They know me. They know what the treatment looks like. So they can at least give me some pain medication, give me anti-nausea medication, and give me the first dose of panhematin. And then they actually will call over to the emergency room and say, hey, we're sending this patient over. Like, she needs to get admitted. So you've like taken out sort of like that middle step of like, I don't understand what this is. What am I supposed to do with you? Like, where I think a lot of the frustration of going to the hospital comes with.
Yeah, because that middle step is a very, very long step.
Yeah.
It's a very big pain in the butt. So, I mean, that's really good advice. And I think a lot of people, just like me, I mean, when I'm not having an attack, I'm like, I don't have porphyria, and then I forget about it. And then you you kind of get into the hospital again, and then you're yelling at people like, hey, just like do what I tell you, and then you kind of basically just don't pay attention to the whole care plan aspect of it. And I think, to your point, I think taking some time to really, when you're feeling good, to, I mean, the APF has a doctor packet, but I mean, if you need something a little bit more catered to your situation, sit down and bullet point that thing step to step, A to Z, and be like, this is what it looks like. And then, to your point again, you could just be like, why don't you look at the chart? Why don't you look at the chart? And instead of, because I mean, obviously there's a lot of eyes that can get on that chart, and it just makes things a lot easier than just being, hey, trust my word, I need panhematin, and people are like, where? I don't see anything about it. So yeah, I think that's a very valuable piece of advice. But another piece of advice I wanted to ask from you is, for anybody listening, watching, doing whatever for this podcast, and they're listening to your story, like, how do I be like Missy? Like, I want to be like Missy so bad with porphyria. Like, she's so cool. I want to do this. Like, what piece of advice would you give them to kind of shift their mentality to have your perspective of porphyria?
That's a hard question. I think I would just say, like, I just try to like take each day as it comes, and take each hurdle as like an opportunity to learn, like maybe something new about myself. Like, I try not to blame other people or like other circumstances for where I am, and try to use it as an opportunity just to grow like the person that I am, right? Like, yes, I have this horrible disease, and yes, it's changed my life, but look at all this other cool stuff because of it that like I've been able to do, or the situations I've been in, or like specifically like in my nursing practice. Like I am fortunate enough to be able to understand what so many of my patients go through and can really connect to them because of, the hand of cards I was dealt. And I think turning like turning the story where, like, instead of like, right, like this sucks and I blame this person and this person didn't listen to me and this person didn't do the right thing, to, because of this, I've had the chance and the ability to continue to do all these things. And I'm, you know, a really like special, unique, cool person. And I think like really accepting it and embracing the uniqueness of Porphyria has just allowed me to like fully accept this person that I am. And, I think having like an invisible chronic illness is hard because people look at you and they're like, well, you look totally fine. Like, you look super healthy, which for the most part is basically true. Um,
Hmm.
but like we spoke about earlier, like letting people in and sharing like how you're feeling on a day-to-day basis, or like what is actually going on and what your treatment looks like or what a hospitalization looks like, um, allows something that's invisible to become like a bit more just visible in your day-to-day life. And I think that allows me to sort of live each day to the best of my ability with like how I'm feeling in that moment, and not having to worry about, oh, do people think X, Y, and Z, or, she's acting funny today, or like, why is she doing this? Or, like all those questions, like the what ifs, like just by being open and honest and living authentically to myself, like it gets rid of all those like what ifs and the anxiety of it.
Such a good point, because I feel like in this world we learn to be extremely empathetic to other people and their situations, but I feel like we don't have that for ourselves at all. And I think that's just kind of what I was pulling away from what you're saying. It's just like everybody just beats themselves up so bad, and they don't just say, hey, it's okay to take some time off, or it's okay that you didn't go to the gym today, or it's okay that you didn't have a perfect whatever. It's just like, you're good. Tomorrow's another day. We can shake it off, and we can get through it. But something else I wanted to ask you too before you wrapped up here is there something that maybe we didn't chat about that maybe you wanted to voice out to the world?
I don't, yeah, I don't think so. I think, we touched on like so many aspects of porphyria and a chronic illness. And I think the biggest thing for me is like the support of my family and my friends and my community, and just knowing that no matter where I am or what's going on in my life, like I have the love and support and encouragement of all those people um, in my life.
I mean, that's the best way to put it. So I just wanted to say thank you for taking the time to sit down and chat with me. I know we've been trying for weeks and weeks to sit down and chat, so I'm glad we were able to finally do it. So I appreciate you sharing your story and being open, vulnerable, and sharing all the different aspects about it. So we appreciate it for sure.
Yeah, I was really looking forward to this, and I'm glad we finally got to connect and do it.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.